Welcome back, you beautiful people. It's a Friday and we're still getting that positivity flowing. Speaking about positivity, a group of 30 general practitioners from the Gauteng Province stepped out of their comfort zones and availed their voices to create an inspiring music video for the song Voices That Care.
The doctors filmed the video in isolation from their places of work and would like to use this video to show their support to all South Africans from the frontline healthcare workers themselves.
Now, two of those doctors who star in the Voices That Care music video joins us this morning. Please welcome via video call Dr. Daniel Israel and Dr. Karin van der Merwe. Good morning, doctors.
Thank you for having us.
Oh, we love having you and we love hearing your story. I mean, who knew we have so many talented singers in the medical profession? But Dr. Daniel Israel, maybe I'll start with you. You know, what inspired you to create this video in the first place?
So I realized that I couldn't carry on as a doctor with everything going on. I decided I better take up a job as a singer. No, I'm only joking. I realized that in South Africa at the moment, there is such a need for encouragement in these difficult times. There's so many videos out there with doctors, the public singing to doctors and frontline, but there's not much about the frontline singing back to the public and telling them that we're here for you and we care for you. And I felt this would be a great opportunity to build camaraderie between doctors and to reach out to our patients and people in general to say, even though you're alone at home, we're here for you and we care for you. That was the initial motivation.
It's a fantastic initiative, Dr. Daniel, but this video also marks the launch of a much broader Voices That Care project that will support and educate patients during this time. Can you please tell us more about this?
Sure. So Karin, my colleague over here, has made a collaboration of GPs, which he'll tell you about in a few minutes. But my idea with this video was that we'd be able to reach out to as many people as possible. We've now taken it to a second level where Karin is compiling a whole lot of articles that are evidence-based, where people can read the articles and watch the videos we put out and learn what really matters with coronavirus and what doesn't, how to remain safe, how to keep your kids safe at school, how to enter the workplace. We felt this is our opportunity to reach out, which we've started doing on social media, and the uptake has been wonderful this week.
I love that. And, you know, just working in the space now, we're fighting COVID-19. And I like the fact that you say the group effort that you guys are all getting involved with that. Dr. van der Merwe, what does a normal day at work look like for you? And I mean, what are some of the measures that you're doing to put in place to prevent yourself and protect yourself from the COVID-19?
So our normal day at work is quite quiet at the moment. I think a lot of our patients are a bit scared to consult us. And that can be a problem because people with just normal everyday conditions are not coming to consult their doctors. But they can be assured that we really have our practices as safe as possible. We have all the measures in place that are there that they won't be catching COVID when they come and visit us. And of course, we also have to protect ourselves. So we wear all our PPE, our masks and our visors. But otherwise, we just want people to know that as GPs, we want to be there for them, whether they think they've got COVID, whether they still have chronic conditions that need attention or some acute condition. They must reach out to their GPs, and we just want to be there for them.
And Dr. Karin, Dr. Daniels earlier touched on the collaboration that you have with the GPs across the country. Before we let you go, we would like, to get some advice from you to South Africans on how to protect themselves from the virus.
I think a lot of that advice is out in the public, wearing your mask and not getting close in contact with the other folk and just following the general guidelines out there. But we've got to get back into society. One of the slogans that we're using in our Voices That Care is we can't be locked away forever, so let's be safe together. And that's what we want to teach people on the Voices That Care campaign. That society has to open up, but we can do it in a safe way. So please come to our Facebook page, the GGPC Facebook page, and you'll find all that information.
Love that. We love chatting to you. We love the message. We love the positivity that you're spreading right now. But thank you to both of you, Dr. Karin van der Merwe and Dr. Daniel Israel, for just spreading that message of hope for us. And thank you so much for your time this morning.
It's a pleasure. Thanks for having us.
Thank you. Keep safe.
A massive thank you to all the medical practitioners who partook in the Inspiring Voices That Care music video. We, as the Expresso family, would like to express our heartfelt thanks and gratitude to all the healthcare heroes.
It is only with your dedication and skill that we can get through this difficult time together. We salute you all. And I think it's only fitting to end off with a music video that went viral, so take a look at this.
We'll see your face again. You have a way defend. So stay at home till then, till then. Hey. Stand tall, stand proud. Voices that care are crying out loud. And when you close your eyes tonight, feel in your heart how our love burns bright. I'm not here to justify the cause, or to count up all the loss. That's all been done before. I just can't let you feel alone. When there's so much home at home, we're singing out to you. All the courage that you've known, the bravery you've shown, clearly lights the way. We pray to make the future bright, to make the wrong things right.
Wrong. We're all praying you remain strong. That's why we're all here and singing along.